My next guest has proven time and again he's not one to shy away from a challenge. A Rhodes Scholar, former player in the N.F.L. Myron Rolle is now a doctor in his third year of a neurosurgery residency at Mass General Hospital, working on a floor that's been turned into a dedicated wing for patients with coronavirus. Dr. Rolle, it's good to meet you. Thanks so much for joining me.
Thank you for having me.
So, as I mentioned, you are trained in neurosurgery. That's your specialty. You're now treating people with COVID-19. I know it's all hands on deck, but how do you know how to treat people with infectious diseases?
Well, our hospital has been amazing at allowing our medical attendings and our medical residents sort of the freedom and the liberty to lead the way, to give modules, to give teaching sessions, to teach us how to gown properly to go into these rooms with droplet and contact and isolation status, right? So as neurosurgeons, we know how to take out brain tumors and fix spines, but this is something that's new to us. And so in order to be flexible and adapt and listening, we've taken good instruction. We've been trying to do the best we can for patients. And honestly, all the manpower that we can provide this hospital and this effort is what we want to do. We'll cancel our cases, postpone our elective cases. We'll even, commit to turning our operating rooms into ICUs if need be. And so our chairman, Bob Carson, has been wonderful about allowing us to, really just help this hospital-wide effort.
So yours was a neurosurgical ward. It is now a COVID-19 ward. What is that like?
Well, it's vastly different. I mean, how we take care of these patients, how we respond as clinicians to their needs. We have infectious disease consults. We have to get the right scans, the right tests. We have to get the biothreats team involved. So obviously, it's different than the day-to-day things we would do typically in neurosurgical disease burden patients. But nevertheless, these are people who need help and need the manpower. And we also have to just protect ourselves so that we're able to valuably or be a valuable contribution to the effort against COVID-19. Our hospital has done, I think, a great job at leading the way, and we're just sort of falling in line right now as residents and attendings and nurse practitioners.
I want to talk to you about protecting yourselves. I know that everybody at MGH has to wear a mask, and Dr. Paul Bidinger joined me yesterday, one of your colleagues, who's head of the Center for Disaster Medicine, a hell of a title, I should say, for now. He mentioned that a warehouse that you guys try not to use, about an hour outside of Boston, I used the term raided, and he used the term utilized, to get supplies to protect people doing what you do. Do you have adequate protective gear, you and your colleagues, to do your jobs?
I would say yes, we do. It has been relocated to a different area, and you have to know where to get those masks and those protective gear because the hospital, I think, is trying to conserve resources and make sure they're being allocated correctly and appropriately. For instance, if we still have a neurosurgical case going on, our mask and protective eye gear and things like that wouldn't be right where we would wash our hands and get prepared for the case. They'll be in a centralized location. So they're still available, but they're being parsed out and spread around the hospital and dispersed appropriately for all staff members who come in contact with COVID-19 patients. Because what we do know about this very novel disease is that it's very infectious, and we want to protect everyone who's taking care of these patients.
It's an odd question to ask you in light of the fact, one, you were just smiling for a minute there, and two, it's even odder to ask a guy who used to do what you did for a living. But are you ever scared in the middle of this pandemic doing your job?
So there's uncertainty for sure, and I think that provides the space to be a little bit scared, to be a little bit nervous, to be a little unsure on what to do next. But I think my training, being an athlete my whole life, basically since I was 6 years old, has given me the traits and the characteristics to mitigate pressure, stay calm, listen to instruction, take coaching, go back to your fundamentals, and focus on the team goal, the collective goal here. It's not about us or me or what we do as neurosurgeons in this hospital. It's about the overall team goal of approaching this disease, mitigating it, managing the best we can with those people like Dr. Bidinger and other health professionals at the forefront, our nurses who are doing a wonderful job in the ED, being overly exposed to these patients. They're doing a wonderful job, and we just have a great team here, and it's important that we are part of this team at this point.
You know, speaking of you being an athlete since you were 6 years old, I was reading something about you the other day. You're a Jersey kid, right? Is that not your New Jersey?
That's correct.
Right? And I read you're growing up in your room. You're a little kid. I don't know if you were ever a little kid, but you were a kid. And you have two photos in your wall. One, I think everybody would not be surprised by, Deion Sanders, one of the greatest football players who ever lived. And one was a guy we've come to know in this country. He's currently the Secretary of Housing and Urban Development and a retired neurosurgeon, Ben Carson. Why was Dr. Carson on your wall, Dr. Rolle?
Yeah, Dr. Carson was on my wall because he wrote this book called Gifted Hands that I read in fifth grade that was so amazing. His story going from the inner cities of Michigan, Detroit, and having parents that focus on education, being black, having a bit of a temper. I saw a lot of similarities in his adolescent years that I had in mind. I had a bit of a temper when I was younger. My parents focused on education. They placed a premium on doing well in school. We didn't have a lot of money growing up either. We left the Bahamas and then moved to New Jersey with not much. And so he became this beacon of hope for me. I said, I can do what he's doing at some point. And he got the interest of neurosurgery sparked in my mind and in my body. And then I just continued to pursue that as the years of education continued. And now I'm here, and it's just been a fun ride, an amazing ride.
At maybe the best hospital in the world, or at least one of them, I should say. Before you go, though, what you used to do for a living, people's state of mind probably matters now as much as the state of their body. And one of the great American distractions was what you and former pro athletes did for a living. It's all shut down. If you were doing a little Nostradamus, will there be pro football in the fall, or are we still going to be pretty much in the state we're currently in?
I think we're going to be further along than we certainly are right now, but I would doubt that we'd have a season in the fall. That's just my prediction. I think there's a lot of hurdles to go through still. I think there are a lot of checkpoints. I think there are a lot of people still suffering and hurting, and there's a strain on our healthcare system. Not a huge hospital like Mass General that's got all the resources and wonderful leadership, but some of the smaller community hospitals around the country still being affected by this in very perilous and ominous ways. And so I'd say that if I were the betting man, I'd be shocked to see the NBA continue, the N.F.L. have a season in the fall, and these sports leagues continue. And I think that's for good reason. You need to protect your fans, protect your players, and put America's health as a premium right now, rather than our entertainment and our convenience.
It's good to meet you, Dr. Rolle. Congratulations on your work, and my best to all of your colleagues.
Thank you very much. I appreciate it.
Thank you.